So because he had Terry's nails, 80-20 nails, two reasons most common are the kidney or liver disease. So we wanted to check. He does have kidney stones, chronic, it's been always there, but the nails have also been like that for a while. I remember them that way. What I want to show you is how to palpate the liver. There are a couple of ways you can do it. First of all, you tell them to breathe out, vidach. As they breathe out, your fingers go in, and then you ask them to breathe in deep, 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 глубоко, глубоко. Возьмите вдох, глубоко, take a deep breath. Да. And so you can feel where it pushes, and then you go below it. Выдох. И глубоко вдох. Вдох. Yeah. So this is the end of the liver. So here it is the end. Now, it could be that the liver is pushed down by the lungs or by the heart, by the diaphragm pushing down, but the other way of doing it, so this is the end of the ribs, and you can see this is how many fingers? It's about 3, maybe 4 fingers below the right costophrenic angle, the angle of the rib cage. So that means that it's a little bit pushed down. The other way to do it is to hear the through percussion sound. So this is checking for spleen enlargement, and you can hear a hollow sound. On the other hand, when you do it here, it's not hollow, it's dull, but you go deep lower, you can hear again the sound. Can you hear the sound? Mm-hmm. Listen. Different, that's hollow. So that's how you know that there's a little large. So your daughter was right, it's a little bit, liver needs to be checked. So do an ultrasound, examine the liver, and depending on what's the reason, you will decide how to best approach it. But it could be related to diet, it could be related to medications, it could be related to heart that affects the liver. Whatever it is, despite the fact that it looks like his albumin levels are normal and creatinine, you said, is normal, there are other reasons that can affect it, and despite that, other parameters may appear normal. So I suggest you take care of it, and you can treat it, and as I said, you can take some supplements that can help the body repair some of it. So when you're not sure exactly what it is, I love personally NMN or NAD, but the NAD that is effective is the IV form. I don't believe it's effective when you take it internally because it gets broken down by the gut and does not really get absorbed in its proper form. And the NMN is the precursor to the NAD that's been shown by David Sinclair, the famous author of Lifespan book, to absorb well, and this is part of vitamin B3 synthesis pathway that with age, after the age of 30, are enzymes that are supposed to break that vitamin down to its useful molecule products that are able to give our body the ability to repair much of the damage that occurs is not in sufficient amounts, while the amount of damage that we need to repair is expanding. So doing that gives our body a little bit the ability to do it, because truly our body is so smart. It can really repair itself. All we're trying to do is try to mimic the body's ability, the immune system and everything, but it needs to have the necessary tools. You know, it doesn't matter how smart you are, if you cannot have the necessary ingredients, you can't create the composition. All right, so ultrasound and NMN if you want to, and you let us know how it goes. Thank you. If you liked the episode and found it useful, please let us know by liking us and leaving a comment. Thank you.